Lots of questions came up, and subsequently we have had two presentations from Dr. Padmavati and Tiruchelvi. My presentation is very focused on the district mental health program. After listening to the deep briefing, my thoughts were as follows: that there were lots of questions, there were big confusion, we are mixing up policy, act, government's district mental health program, national mental health program, lot of crossover, and more questions were being raised. Again, attending the whole morning session right from the beginning, number of things came up, and as I was going through my pad, there was great joy at some time, great concern at some other point in time, because many people talked about different aspects of the district mental health program. The minister said it has been a big failure all over the country, but it's been a big success in Tamil Nadu. And he explained to us, not the minister, the secretary, why it is a big success in Tamil Nadu. And if it is from the health secretary or the state, then of course we can believe it. It indeed must be a big success in the state. We heard from Vandana. She said, DMHP, 25 years, what's happening? Where is the National Mental Health Program? She was not very pessimistic. All that she said was that we must have a relook or a review of the district mental health program and the national mental health program. Then we listened to Akhilesh, who said it is an abject failure. Later on again we heard from somebody who summed up the morning that the DMHP has been a failure. So when you hear these kinds of things, and then of course we heard from Tiruchelvi, if the three doctors who are not psychiatrists, who are not mental health professionals, who are general doctors, if they can be trained to manage psychiatric problems, mental health problems, why can't it be done by other people? In fact, I thought she should be declared as an advocate for the district mental health program and the decentralized services. So the point I'm trying to make is, if you hear these kinds of discordant things, that it has been a big success in Tamil Nadu, it's not been a success, it's an abject failure, what has been happening, so much money is there but no money is being made use of. Later Nimesh Desai clarified, no, it is not underutilization or unutilization, it was a delay in governmental procedures, etc. So what is really happening? And for me, as an individual who has been working on the district mental health program, and what went through my mind when I heard all these was some 20 to 25 years ago, when I used to go every month for about 2 weeks perhaps, every month between 1985 and 90 to Bellary, which was about 350 kilometers away from Bangalore. We chose Bellary because many people said that if you develop a program near Nimhans, nobody will believe you, because they say that Nimhans is doing it. You have to go and develop it and demonstrate that such a thing can work in a place very far away. And those days there were no night, there were no buses, no trains. Today if you want to go to Bellary, it's very easy. There is even a flight. Today Bellary is known for the Bellary brothers who are making a lot of money from the mineral-rich district. Those days it was a dust-prone, drought-prone district where nobody wanted to go. It was much later that Sonia Gandhi and Sushma Swaraj chose Bellary to contest the election. At that time, Bellary was not known for any of this. So we chose Bellary to develop a program and demonstrate that it is possible to train primary care doctors. If the ideal situation is created, we can make access to care possible, we can make people aware of psychiatric disorders, etc. Of course, it's a different matter, it's not occurring now. Now I told you already, Bellary is known for different things. So what is really the situation? If it can be a big success in one state and not at all a success and an abject failure in some other state, if money is being given and people are not making use of it, what is the real situation? So what I thought I would do is to very quickly, and I won't take my full time. In fact, as I was preparing for this presentation, it was Miriam, I don't see her in the audience. She is the one who gave me the directions about what I should do, how much time, etc. I prepared the presentation based on her instructions, how much time, how many slides, etc. I would not make use of all that because I know there are 7 other speakers. We are only at 12:45 as Nimesh said, so I will take much shorter time. And what I thought I would do is, if you have to understand what is really happening and why is that we are hearing all these discordant things about district program being good, not being good, it's a failure, etc. We have to understand the context, we have to understand the history, we have to understand what is really going on right or going on wrong. So I thought I will tell you from this morning I mentioned from 1975 till 1996 when the pilot model was developed. What followed the pilot model and what went on and why is that it has taken so much time? If people are getting restless, and we have been hearing about this for the last 25 years, nothing is occurring. I personally don't believe nothing is occurring. I'll give you some evidence for that. Already Tara has said, may not be only because of staff, it's also because of what the government is doing, that the period of untreated psychosis is coming down. Within weeks people are coming. I mean, you can't do away with this kind of evidence. So what I thought I would do was to tell you what followed the pilot district program, current status and impact. That is my basic brief. I'll tell you a little bit about that. And the third thing that they wanted me to talk about was a future recommendation of the DMHP. But if you have to make future recommendations, you need to also understand what is the world talking about. Is everything going on all right? This morning, Minister referred to Australia. Somebody else referred to United States. Are things all right there? Is mental health very different? Is everything going on very well? They have huge resources, large number of psychiatrists, psychologists. Are things much better? I will respond to that. I will tell you a little bit about that. And I will also tell you about the changing focus in health policies of the government or the World Health Organization, the World Bank, etc. Because we are trying to integrate mental health into primary health care. But primary health care itself has been changed. And then I will make some comments on the future recommendation. Very quickly. What followed after the Bellary program? Nothing occurred because in the NMHP there was no funding at all. The pilot district demonstration project, it occurred by about 1990, etc. So we had to do a lot of work. When I mean we, I mean various people responsible for the program, primarily located in National Institute of Mental Health and Neurosciences, but also within the ministry, from non-governmental organizations, other people who believed in this kind of philosophy. Training of trainers programs were done. In fact, many of the people who took up the district program later on in their respective states were people who came in for the training of trainers program. People like Dr. Shiv Gautam in Rajasthan, people Karthikeya Krishnamurthy in Andhra Pradesh, etc., etc. State level sensitization workshops were held, national works. In other words, what was done was to create the right kind of awareness, to start the program and have a budget head. Further recommendations of the Central Council of Health and Family Welfare. I referred to the Central Council of Health and Family Welfare this morning. It's the highest policy making body. Nothing occurs without their recommendation. They made several recommendations in meetings held in 95, 99, 2001. I will not read this. This is essentially saying that it's a summary of all that all of you have been saying. Mental disorders are important, there's so much of disability, there should be early identification, why should there be so much stigma? So they made specific recommendations that there should be funding made available. So for the first time in 1996, although the National Mental Health Program was accepted by the government in 1982, nothing occurred in the first 14-15 years. The budget head was created only in 1996, 14 years after the approval. DMHP was to be implemented as a fully centrally supported project. This is something which you must understand because in the field of healthcare, there are centrally supported schemes, state schemes. There are partly centrally supported and partly state supported schemes. No, none of the states wanted to initiate any mental health program. So the government of India came up with this DMHP program with full support, with full financial support. So DMHP was launched in 4 states in Andhra Pradesh, Tamil Nadu, Rajasthan and Assam, progressively introduced in 27 districts and then further expansion in 10 plan, 11 plan. As of now it is about 125, 27 districts. As Vandana clarified, it is still only 1/4 of the country. But you must remember that India is a huge country, 600 plus districts, 1.1 billion population. If others have not got it right with much greater resources, they can't be expected to get it right for a huge population in a short period of time. This is to give you an understanding of the kind of, from nothing in 1996, we now have about 437 crores, although the initial allocations were much more. This also did not occur automatically. Review of the progress was done by the government in 2000. An audit of all the DMHPs were done in 2003, and much more recently, an independent evaluation by the Indian Council of Marketing Research, which is a corporate body. It's a thing of the Banyan Consulting Limited, because the Government of India and the Planning Commission wanted an independent inquiry. Because if the government does its audit, its own program, it will of course be shown as successful. NIMHANS, of course, is not government, but it's an autonomous body. The criticism was that the people who are doing the audit are the people who created the program or who supported the program, so who had a bias in saying that it's all going on well. So that is why the most recent review was done by the Indian Council for Marketing Research. So what I'm now going to do is to tell you about the current status and the impact, which is what we need to know. We have heard various things, but what is the reality? Do we have any data? Has somebody gone and really looked at whether this is success, failure, etc., etc.? I must also say that I'm indeed very happy to be making this presentation, because till 2005 I used to do this routinely. But then it is to a group of very uninterested, maybe psychiatrists of the Indian Psychiatric Society who don't believe in district mental health program or who don't believe in any kind of community-based programs. There may be a bigger number who believe in this program, but those days, when you have a session on this, there would be 3 or 4 or 5 people in any of the conferences. Or it used to be in Nirman Bhavan, which was all government babus, etc., who would anyway, they have a certain attitude. But I'm so happy that there is a serious group who is questioning, who is asking questions about where is it going, what is occurring. I'm so happy about that so many people are interested to listen to the current